Assalamualaikum warahmatullahi wabarakatuh. Good
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, sir. For evening, ladies and gentlemen, Duta BPJS Kesehatan all over Indonesia. Welcome back to Initiative National Debate Competition, INDC 2024. It's very good to see you guys here again. Before we start, we'll make clear that you're joining the round 8, session 2, room A, and this evening we will witness an exciting match between Team Singaraja Run Happily from Capil 11 as the affirmative house versus BTW, or Born to be a Winner, from Capil 2 as the negative house. And first, I would like to introduce myself. My name is Fadila Teherani, or Dila for short. I'm from Kantor Cabang Kendari, Kedeputian Wilayah 9. And this evening, I will be your moderator to lead the session until the end. And I'm with my co-moderator, Mr. Kira. And I'm with Corporate University to help me operate and timer for today's session. And then I would like to say hi to our honorable adjudicators for this session. The Gentleman Club, the first adjudicator is Mr. Ichwansyah Gani.
Hello, good evening, everybody.
Good evening, sir. How are you? And
Fine,
then,
just fine.
thank you, sir. And then the second adjudicator, we have Mr. Achmad Krisnawan. Good evening, sir. How are you?
Good evening, Dila. Assalamualaikum warahmatullahi wabarakatuh. Nice to meet all of you guys.
Nice to meet you, sir. Thank you, sir. And then the third adjudicator, we have Mr. Zaldi Elnino. Good evening, sir. How are you?
Good evening, Dila. Thank you. I'm very excited about the motion, to be honest.
I'm excited too. Okay,
Yeah.
for the adjudicators, please let us know if there's something to clear out. And thank you once again for joining the session in time. And thank you for giving your precious time to INDC 2024. And here we have two teams who already joined, and allow me to introduce the contestant. The first team is Singaraja Run Happily as the affirmative house. Hi guys, we have Mr. Igderion as the first speaker. Hi, sir. Good evening.
Hi, good evening, everyone. I hope I can deliver some good debate this evening. So yeah.
Okay, thank you so much. And then as the second speaker, we have Miss Luh Aris Ariandeni. Hi, Miss. How are you?
Good evening, everyone. Good evening. Glad to see you again here and keep support each other. Thank you.
Okay, thank you so much, Miss. And then the third speaker, we have Miss Endang Riana. Good evening, ma'am. How are you?
Hello, I'm fine. Good evening, moderator. Good evening, honorable adjudicator, and good evening, our very support negative host and all the participants in this room. Thank you very much.
Thank you so much. And then they are also with their counselor, their honorable counselor, Mr. I Putu Erika. Can I hear your voice, sir? Is he here?
Hello, everyone. Good evening.
Hi, good evening, sir. Thank you so much for your time. And then we're moving to the opposition, or the negative house. We BTW, or Born to be Winner. And speaker, we have Mr. Anggi Pramana. Hi, sir. How are you this evening?
Hello, everyone. Good evening.
Evening. Thank you so much. And then as the second speaker, we have Miss Aulia Hairani. How are you this evening, ma'am? Miss?
Good evening, everyone. I'm good. Thank you, Miss Dila.
Thank you so much. And then the last, we have the third speaker, Mr. Kurniawan. Hi, Mr. Kurniawan. How are you?
Hi, good evening. I'm good.
Thank you so much. And then the BTW team are here with their honorable counselor, Mr. Muhammad Fahriza. Can I hear your voice, sir?
Good evening, everyone. Good luck to both team, but BTW is the winner.
Thank you so much, sir, for the support. And thank you for your time in this session. And I would like to say hello to all the audience in the Zoom meetings, to the audience, the chat box is yours, and everyone is open to give your support and share to your favorite team. But remember, it is a safe space, so please keep it positive and be kind towards each other. And then before we start, allow me to read some small rules for all the participants in this session. The first is no participants are allowed to open their microphone before their own turn. And then the second, team member must rename themselves with name. For second, third, or counselors. And then the third, each team member must join with their own Zoom account and not allowed to join in sharing account. And fourth, the operator may do the necessary thing to make sure that this session runs smoothly. And then the last rule for tonight is to have fun, and good luck to you all guys for this session tonight. Okay. Ladies and gentlemen, and our honorable educators, without any further ado, let's start the debate. So this motion for this session is: this House believes that the National Health Insurance Program, or JKN program, should cease providing coverage for elective surgical procedure. For both team, each speakers, you have 3 minutes for stating your statement. And then I hope that everyone is prepared for today's motion, and you guys should use your time wisely. And then the first chance of speaking comes to the first speaker of the affirmative side. Are you ready?
Yes, ready.
Okay, I would like to ask the help from the Corfu team to set up the timer for 3 minutes. Okay, thank you so much. So the timer is on the left corner, guys. And for the first speaker of the affirmative house, your time begins once you start speaking.
Good evening, honorable adjudicators. We, the affirmative house, stand in agreement that BPJS Kesehatan should stop elective surgeries. Why do we support this motion? According to the Compass.com, Mr. Abdul Qadir stated that there was an increase in claim exceeding around 40 trillion. It is predicted that in 2024, BPJS Kesehatan will face a deficit of approximately around like 18.9 trillion. This means BPJS Kesehatan net asset will be diluted, leading to a deficit and potential default. Actual calculation estimate this deficit could grow to 19 trillion by 2025. Faced with these looming financial challenges, we must act decisively. According to the law number 40 of 2024 concerning the national health insurance system, the government has 3 options to address the deficit. First, increasing the contribution amount. Second, reduce benefit. Third, provide government bailout funds. Considering the current condition, we choose to reduce benefits. Specifically, we propose to stop certain elective surgeries. Elective surgeries are not non-emergency procedures that can be postponed without endangering life. They fall into 3 categories: urgent, semi-urgent, and non-urgent. We suggest limiting the non-urgent categories, which can be delayed up to a year. Our proposal includes first, immediate cessation of elective surgeries such as for soft tissue tumors. Second, replacing expensive elective surgeries with more affordable alternatives like using SWL for stone surgeries. The third, stopping coverage for elective Caesar section based on the Robson classification for plain Caesar section after previous Caesar section. And also data from SSBI indicate that in 2023, these three types of cases consume a significant portion of the budget, as the ASWL costs around 44 billion, soft tissue tumors around 2 trillion, Paco emulsification around 4 trillion, and Caesar section around 7 trillion. By limiting elective surgeries in these manners, we can substantially reduce service costs. Interestingly, a similar reduction occurred natural during the pandemic when the hospital limits surgeries to emergency only. This results in surplus fund. In conclusion, to manage our budget effectively and ensure the sustainability of BPJS Kesehatan, we must take bold steps to limit elective surgeries. This approach will help us navigate financial and secure the future of our national health insurance system. Thank you.
You still have 2 seconds. Okay, thank you so much. From the first speaker of the affirmative house. And then next is the first speaker of the negative house. You have 3 minutes and your time begins once you start speaking.
Honorable the adjudicator, moderator, participant, and audience, this House believes that the National Health Insurance Program should not cease providing coverage for electing surgical procedure because the elective surgical procedure not covered, the disease that require quite a lot of money. And what we know that our current economic condition is not well positioned. How will people get health treatment? Is the JKN program not for all Indonesian people anymore? What if poor people need services for this disease? Are we going to the day before the BPJS Kesehatan exists? People have to sell their race field and all valuable asset if they get sick. If this the best solution according to the first group, did the first group think about the impact after this is implemented? The economic level of society will decline. After that, children will drop out of the school. Friend case will increase. People will try everything they can to get the money so they can pay for their family health treatment billing. Can adjudicator and affirmative team imagine what will happen after these policies are implemented? Public trust in government will decline. Inflation will be everywhere. Based on data in USA by Journal Health Insurance Status, finding of this cohort study suggests that an insured patient more often undergo unplanned surgery for condition that can be treated electively with worse outcome and longer hospital stay compared with their counterpart with health insurance. Patients without insurance had higher rate of inpatient mortality. Honorable the adjudicator, moderator, participant, and audience. From this data and what's happening in it can be consideration for us in making policies. Don't take the wrong policy, which will impose this problem on society. Furthermore, to support my statement, the next speaker will explain about things that BPJS Kesehatan and government can do as a solution to this problem. This study that occurred in Indonesia and several countries as well support data that will impress that case providing coverage for elective surgical procedure is not the solution. This House believes that the National Health Insurance Program should not cease providing coverage for elective surgical procedure. Thank you.
Okay, thank you so much from the first speaker of the negative house. And then moving on to the second speaker of the affirmative house, you have 3 minutes for your statement, and then your time begins once you start speaking.
Okay, good evening, everyone. Honorable adjudicators, I'm Aris, the second speaker from the affirmative house.
I'm sorry, is there delay?
Check,
I'm sorry.
check.
Can we start? Because
Check.
again? I'm sorry.
Check.
Yes, we can
Check.
hear you. Maybe
Sudah
the
di-unmute?
signal is not
Check,
so
check.
good.
I'm sorry. Can we start again? I'm sorry.
Can we current the laptop because the internet is dropped in Aris.
To the teammates from the Singaraja and Happily, maybe you can help the second speaker to change the signal.
Yeah, we on the maintenance actually. So yeah, I'm really sorry about it. So yeah, it on maintenance.
Hello. Is it clear? Sudah kameranya sudah hidup.
Ya nggak apa-apa.
Okay.
You already joined? Yes.
Yes,
Maybe you can
but
continue.
the video doesn't show. Okay. Good evening, everyone. Honorable adjudicators, I'm Aris, the second speaker from the affirmative house. Respond to the what's first speaker from the negative house say before. Stop covering elective surgery, for example, for cases we mentioned before. Doesn't mean we to providing it, but if the patient in emergency it's not elective anymore and we still cover it. Remember, we're not discussing about the emergency condition based on strata decision technology. Most elective procedure do not pose immediate life-threatening risk if delayed. So we can maximize or focus on preventive care is what on what the negative house speaker did before. According to WHO, for the C-section case, the delivery rate about 10 until 15%. And in Indonesia, based on risk death 2018, the rate is 70%. And this rate increased since introduction of BPJS Kesehatan, rise about 40 until 50%. And also research from Erlangga University found that BPJS fund C-section cases fall into Robson groups 1 until 5 groups, which include low-risk mother. By strictly applying the Robson method in hospital, we can prioritize normal deliveries. Moreover, based on POGI Health Journal, exceeding the standard limit for C-section can increase the risk of death and disability for both mother and children. Therefore, limiting some of elective surgical does not mean increasing mortality rate. Okay? And if BPJS Kesehatan in deficit condition, it will impact everyone, leading to delays payment to healthcare, affecting participant satisfaction and our reputation. When the visit house payment delays sometimes up to 6 months and the health facilities struggle for it. Therefore, we believe limiting benefit to stopping certain elective surgeries is the best choice, as what our first speaker mentioned before. Elective surgery are non-emergency procedure that can be postponed without endangering life, and it can delay up to 1 year. Are there other nations that have a limitation on surgical procedure? Yes, of course. UK, US, Spain, Saharan Africa, and South Asia have experienced and managed limitation on the elective surgeries through the social security system, particularly in COVID-19. Thank you.
Thank you from the second speaker of the affirmative house. Next is the turn from the second speaker of the negative house. You have 3 minutes and your time begins once you start speaking.
Okay. Thank you for the chances, the honorable adjudicator, ladies and gentlemen. I'm going to respond from the first and second speaker from the affirmative house. If the consideration of this motion is due to anxiety regarding to the deficit and all for the non-emergency of the elective surgery, uh, regarding the deficit that will occur in BPJS Kesehatan, we are to have on 11 of the the government the authority to regulate contributions supported with government regulation of the Republic of Indonesia number 87 of 2013. In the event that BPJS health finances experience a deficit, there are 3 options that can be issued, which is the first
Ini masuk ke mosi yang Adam kirim
speaker
ke saya,
of
Mang.
the affirmative house already mentioned, adjustment of operational funds assisted by government, adjustment of contribution amount, and the last one is benefit adjustment. These 3 solutions, in our opinion, the choice is in accordance with the statutory order. We must prioritize the community above it all. And then, ladies and gentlemen, we also need to remember when BPJS Kesehatan was first formed, our organization aim was for a better Indonesian public health, not public health only for whose treatment was not an elective surgical procedure. According to BPJS Kesehatan, hymn which we sing every morning, berjuang bahu-membahu, wujudkan harapan bersama BPJS Kesehatan untuk rakyat Indonesia. Have we worked together to provide the best service for the community? And furthermore, what we need to consider together is if this elective surgery is not covered, then we can imagine if this delayed by the patient so that it becomes a complication or get worse, and so it becomes an indication for cheatal surgery. Imagine the cost we will incur. How much is the difference between the cost of elective surgery and cheatal surgery? As the second speaker also mentioned that this elective surgery, elective procedure is not, we say not covered, but it will be covered, but we wait for the emergency cases. And not only that, the risk faced by patients will be greater if they undergo cheatal surgery rather than elective surgery, as per the journal of the risk of death was higher for participants. From the affirmative group, there is that cost. And then if we talk postpone, the mortality is getting higher and the cost is also getting higher. And that's all from me. Thank you.
You still have 15 seconds left. Do you still want to use it?
No, thank you.
Okay, thank you so much from the second speaker of the negative house. Next is the third speaker of the affirmative house. 3 minutes, and your time begins once you start speaking.
Hello, can you hear me?
Yes, I can hear you. It's your song.
Educator. Previously, we would like express our gratitude for the negative response, but we understand point and another visit. There are choices we must make.
Hello?
Excuse me, I cannot hear clearly. Is it because the signal or just me hear clearly?
Oh, yeah, actually, I'm really sorry about it. Is problem actually is signal here not really, like good. So we need to maintain a little bit. So yeah, I need time a little bit. So I'm really sorry about it.
Okay, thank you.
That was really
So maybe we
a
could
problem.
give her some time, yeah, talk when the signal is good. Thank you.
Thank you for your willingness.
Is the third speaker already rejoined? Okay. So to the third speaker of the affirmative house.
Hello, I'm
Okay.
sorry because
Okay.
I'm in hospital. Sorry.
Okay. So you can start
Okay.
speaking, but your time left is 2 minutes, 20 seconds. Are you ready?
Okay.
Okay.
Dear Honorable Adjudicator, previously we would like to thank you for your response. But change is certainly not pleasant for everyone, especially for GCAN members who have been very comfortable with our extensive health service that seems to have no soul limit. So easy. Meanwhile, in many countries that have social insurance, even they developed before us, many have implemented restriction on FS operation. We also remind you that this type of surgery can be eliminated or postponed because it falls into the category of postponing elective surgery, which can take up to a year. There's no emergency about that and no mortality rise. In 1 year, many things can happen. Our investment can be deployed. There is no harm or any impact on the patient's health regarding complaints. It's journal, medic. We can carry out risk mitigation. What else? Claims are not paid for months to health facilities. We will be blown out by the media as an organization that generates continuous deficit. Which one most easier for us to manage the risk? Do we think just about a little part of elective surgery or the sustainability of JKN as big problem? Let's think wisely. On additional information for us, the elective surgery that we mentioned about has no big cost. Action plans handling health service carried out by organization, especially how big the possibility of inefficiency or fraud in this case. You can just see that SG on beautiful dates is generally very high. So difficult to control if we are not strict from now. General prediction in gatekeeper center used to be able to work on soft tissue tumor cases without risk. But now everything has to be in the operating room. So why has the pattern now changed as if? Because of this convenience, this shopping pattern turns to increasingly threaten the cost of health service. So once again, we emphasize to all listeners that we must have the courage to make a breakthrough. Like medicine that tastes bitter, policies that will disrupt comfort during this time will also taste bitter. However, we also convey that anyone who is or is going to be sick, if they want to recover, their choice is to drink bitter medicine. So please take this motion that can be a new regulate to add it to maintain the sustainability. Thank you.
Okay, thank you very much from the third speaker of the affirmative house. Now it's the turn for the negative house to state back. To the third speaker, you have 3 minutes and your time begins once you start speaking.
Okay, for this time, just for the educator and honorable educator and the audience. The affirmative thought before about the reduction benefit when deficit. We don't agree about the deficit affirmative thought about. In fact, as we know, the experience from our condition of deficit, the reduction benefit, especially stop-covered elective surgery and reduced benefit other diseases, has not been used so far until right now. And BPJS said that according to regulation, there are 3 optionality: increase injecting fund,
the Presidential Regulation Act 7 of 2013. In decision the amount of contributions, the government has other consideration and policies such as a political policy, community capacity, and so they are reducing benefit, especially stop coverage. The elective surgery BPJS Kesehatan cannot be used directly as an alternative source of income. And then the affirmative said that about the surgery procedure, about the surgery section, and affirmative said about the delayed surgery. I want to talk about the differences because we don't agree to underline elective is postpone action procedure. It means not stopping surgery production action. Postpone it means can be delay the action, but not stopping the procedure surgery, but just delay of timing. So in short meaning, the elective surgery have to do. Postpone and stopping surgery procedure are different. So at the point the must do action, elective surgery, in related that we should provide covering by national JKN. So what we are waiting for until emergency and illness getting worse, dangerous for patient, education for emergency surgery, imagine the cost will be must spend money to pay. And elective surgery is non-emergency action, but if we do postpone surgery, it can make emergency. And the affirmative said about the immortality rate, we didn't agree about because immortality rate, we can take the example from the case of sexual caesarea with medical indication. The case of sexual caesarea with sickle patient, the elective sexual caesarea are high. So that we look not covered sexual caesarea in health insurance, but more important, we have to consider potential fraud of section of caesarea. Does the sexual caesarea surgery have medical indication or condition by the doctor? We have to change our mindset and look this point front of this and not hold the disease in elective surgery with solution promotive and preventive treatment that the affirmative said before, because we can take the example, the case of sexual caesarea with medical indication, the case of sexual with medical indication have to do to providing by JKN, and we should providing this case with JKN potential and providing. Thank you.
Thank you very much from the third speaker of the Negative House. Now we are entering the conclusion part, and the first team that's going to deliver their conclusion goes to the Negative House first, and then will be replied by the Affirmative House. So the Negative House, you shall be ready. I would like to ask for help. Yes, thank you, Kogbu. Your time, you only have 2 minutes for this conclusion part. So to the Negative House, your time begins.
Okay, thank you for the time. I'm going to respond for the affirmative teams that only said about the elective surgery is going to be postponed, and also talking about the deficit. As my third speaker already delivered that elective surgery is according to the case about sexual cesarean. The patient need to be go to the procedure right now. She have a narrow back, and then it's just in her DNA, and then I mean people because an elective surgery
It's only me experiencing this one.
Second speaker.
Yes, I cannot hear also.
You can change the connection.
We are sorry to disturb because my second speaker there's no signal. We wait until the signal is good. Thank you. we have fully to it.
Is it me? Hello, can you hear me clearly right now?
Yes, I can hear you. Are your connection okay?
Yeah,
Okay. You can continue. You have
okay.
1 minute left.
Okay. So I'm going to continue about the conclusion from the affirmative already said about the postponing the elective surgery and also about the deficit. In fact, as we know, the experience for our condition of deficit, reducing the deficit, especially cease or stop coverage elective surgery and reduce benefit other disease has not been used so far until right now. And for postponing elective surgery is gonna cost much money than we do the elective surgery right now. So from
Hello to the second speaker of the negative house.
Hello?
Are you done? I'm sorry, the signals is not very
Yeah.
good. We cannot very hear you.
Is the timer still on?
Yes, you still have 18 seconds left. Do you still want to use it?
Yeah, I want to use it. Okay. With these 18 seconds left, I'm going to make sure that the elective surgery cannot be postponed because elective surgery, if we postpone it, it will become an emergency case and it will be cost much higher than the elective surgery. So we would agree about this. Thank you.
Okay, thank you so much from the second speaker of the negative house. Okay, now it's the chance to the affirmative house to apply the negative house statement. You only have 2 minutes for the conclusion and your time begins. I'm sorry, Korfu. Okay, maybe you can help read time. 2 minutes. Okay, guys, to the affirmative house, your time begins once you start speaking. To the second speaker, we cannot hear you. Maybe you can take off the headphones. Okay. Okay.
Clear?
It's clear. Okay, you can continue.
Okay, here our conclusion. In 2023, total health cost of 4 kinds elective surgery mentioned before is around 14 trillion. And if we stop to cover this kind of procedure, we can save DJS as around 14 trillion too. And based on actuarial calculation in 2000. And this elective surgical, we can save this sustainability of the program. The negative house may ask, why stop elective? First, increasing contribution would burden everyone. And second, seeking government bailout fund is not a viable solution for us. And the negative house does not give us a real data about mortality rate to every case we mentioned before, or the worsening condition of the patient of elective surgical if we postpone it in 1 year. To make this motion come true, all of us should take action by providing patients with comprehensive education. We should take this option to help the financial condition instead experiencing failure to pay health facilities. In conclusion, stopping elective surgeries is a strategic move to ensure the sustainability of JKN program. If this motion is accepted, it can help us to the new normal of benefit of the JKN. Our motion makes more sense our motion makes sense to be accepted, like that is a blessing in disguise. Thank you.
You still have 15 seconds left. Do you still want to use it?
I think that's all. Thank you.
Oh. Okay, thank you so much. From the second speaker of the House, and then the time is over, guys, but we will continue to hear. That's what they have to say. And then for the educators to discuss who is going to win for this session tonight. And then I would like to ask the help from Kong to assign the breakout room, please. Okay, guys, and we will come back to you in a few minutes. Bye. Okay, thank you so much, guys, for the wait. I would like to welcome back our honorable educators to the Zoom. To be honest, guys, it's been a tough decision for the three educators for this evening. But I would like to remind you that this is a competition and we must decide which team deserves to go to the next round. So first of all, I would like to invite Mr. Ichwansyah Gani to deliver the comment. Time and media are yours, sir.
Okay, thank you. First, I would like to appreciate both of the team. Yeah, this quite a competitive debate rather than debate that and last week or the first week. Yeah, but yeah, since it's the competition and then since it is the debate, yeah, the both of them have to argue and have data to challenge the topic, the matter that the opponent already already given. So yeah, I think yeah, you are quite good actually, but the team that already give the data is the Singaraja runs happily, yeah, and then the born to be winner, you give the explanation in qualitative, not quantitative. I think you already give your argument and already give a rebuttal, but you don't serve with the enough data to challenge the topic that already given by the Singaraja's Run Happily team. But I've already stated in the first place that this is a quite competitive debate, and I'm really proud of you guys. And then, yeah, congratulations to all of you. Thank you.
Thank you, sir. Next is Mr. Achmad Krisnawan. Time in media is yours, sir.
Thank you, Dila. Assalamualaikum warahmatullahi wabarakatuh. This is the nice debate for me because both of you is try to make argument. Both of you try to make rebuttal. Only a little my suggestion for both of you. In the beginning, you already mentioned the motion is related with the condition of the BPJS will face it in the next year or the next year, and related with the risk of the financial situation. And that is common in our institution to bring everything back to the name of our institution. We are not only what do you call talk about health. We talk about financial. It means we should make a clear understanding about what we should do in this condition. Both of you have a good reason to bring the topics. Even both of you have a really hard argue about the reason why you should have option about the elective operation or something else. One of you said this could be postponed. Another said there is a risk about postpone, but nothing wrong with that. There's a debate. You could just do everything and you bring anything to support your argument. Good for you guys. In the end, only one of you could pass through this night. I hope the one who will take the advantage could bring more in the next opportunity. For the others, keep fighting, guys. As you should proud, you already come to this time, and it means you one of the best from this.
Thank you so much, sir, for the comment and the insight. And then the last adjudicator is Mr. Zaldi. And to also announce our winner for today's session. Time and media are yours, sir.
Okay, thank you very much, Moderator Mbak Dila. First of all, I would like to appreciate not for the both of the team, but for the supporters of both teams. They are incredible tonight. We experiencing a lot of trouble between the teams, but I think none of the supporters is down. I think only the signal is trouble, but not the spirit of the supporters behind you guys. You should proud that you have such a standing supporters. I see Born to be Winner also, they have their own background. I see that is very interesting. But you know that at the end we have to manage to judge that which one of you deserve to pass this. As already mentioned about the debate, adjudicators, the Honorable Pak Iwan and the Honorable Pak Achmad Krisnawan, you already delivered debate that many inspirations from our thought previously before come to the debate. But I think that I need to highlight some of the point. For example, when you try to rebuttal the opponents, what they say, what their opinions about, sometimes they come, the opinions come with the data. So whenever you try to confront the opinions, you should have your own data. For example, Pa Iwan said that it should be qualitative rather than quantitative rather than qualitative, because it shows that you are prepared, not just spontaneously applying what the others say, not just spontaneously rebuttal what the opponents say. So it shows that you are more prepared than the others team. And I think that's it. I like to highlight also about the good point, how the affirmative side of the House is defined, the definitions, because the motion say that we should stop, and we should stop the surgical, that why we need to stop the surgical, because the catastrophic amount of money that taken by those is really big, and it's already mentioned by the negative side of the House that you're not saying it's a big amount if you say it's only postponed, something like that. It's already mentioned before, but that's still thank you guys. It's been a good debate so far, but despite the trouble that you are experiencing before, I think it's quite fair. Yeah, I think it's quite fair to yeah, quite fair to remove all those troubles, because you both experiencing the same, that losing signal and something like that. Okay, that's it. The end of my comments, and on behalf of adjudicators Bapak Ichwansyah Gani and adjudicators Achmad Krisnawan, I would like to deliver the first winner of the best speaker for tonight's session, come from the second speaker of Affirmative House. Okay, congratulations, the second speaker of the Affirmative House. You lost the first the first time you lost, but the second time it's impressed by the adjudicators. And thank you. This is the final announcement of the teams that win for tonight's sessions. So I would like to announce the winner team for tonight's is come from affirmative side of the House. Congratulations, guys.
Congratulations to the winning team.
Good job for the born to be winner. I think you born to be winner, but maybe not this year, maybe next year you can be the winner. Okay, that's it. Mbak Dila, thank you for tonight. See you.
See you, sir. Thank you so much, Mr. Zaldi, for announcing the winner, and congratulations once again to Singaraja and Happily team. See you guys in the top 4, the semifinals, and highly appreciated for the other team that shows us incredible performances until the top 8. You guys did so well in the top 8, and I hope that today's debate give you an amazing experience, and you may not be win today, but you have won definitely in our hearts. Thank you so much too. I would like to say thank you for all the adjudicators for tonight. Thank you for your time. And then I would like to say thank you for all the participants in the Zoom. Thank you so much, guys, for your support. And I guess I'll see you in the next round. Bye. Good night. Have a nice rest.
Congratulations.
Congratulations, Madam.
Thank you.
Madam Enda.
Congratulations.
Thank you all.
Congratulations also, born to be winner. You are guys are great actually.
Yes.
It's a really good debate, actually. I'm really interested in it.
Thank you very much, Pak Iwan, Pak Zaldi,
Yeah,
Pak
thank
Ahmad.
you.
Good night.
Assalamualaikum. Yeah.
Waalaikumsalam.
Madam, be careful if you come to Kepler 2.
Oke, my brother, itu aku sayang, sama-sama hebat, bangga. Thank you, Ja.
Oke. Ya, congratulations ya, selamat ya.
Ya, thank you, Ja.